talk about counseling. Introduction to counseling. Counseling is a professional service that helps individuals to cope with the personal, social, and emotional challenges. Counseling also involves therapeutic interventions and techniques to facilitate personal growth, enhance well-being, and improve mental health. Let's look at psychotherapy and counseling. Psychotherapy and counseling, these are terms that are used to describe the therapeutic process of helping individuals deal with the psychological, emotional, and the behavior issues. Counseling also focuses on specific problems or concerns, while psychotherapy is a more intensive and longer lasting treatment for more severe mental health conditions. So, what is the purpose of counseling? Or let's look at the purpose of counseling. Counseling aims to help individuals identify and overcome personal problems, achieve personal growth, and enhance their overall quality of life. When we talk of personal problems, this could mean maybe an individual is anxious, maybe an individual is worried about his life, and also maybe an individual is also worried with regard to academic issues. Counseling can also help individuals achieve personal growth, especially when it is occurring in terms of counseling for a career. And the counseling generally enhances the overall quality of lives of individuals. Counseling can also be used to address a wide range of issues such as anxiety, depression, relationship problems, and also addiction. Let's look at the types of counseling. The first type is individual counseling. The second one is group counseling. Third, we have couple counseling. Then fourth, we have the family counseling. So each type of counseling is tailored to meet the client's unique needs. Let's look at individual counseling. Individual counseling involves a one-on-one session, and this one-on-one session is between the client and the counselor. Individual counseling is designed to address individual issues, for example, anxiety, depression, and trauma. Couples counseling. Couples counseling involves sessions with the couples to address relationship issues, or it also involves sessions with the couples. Couple counseling. Couple counseling involves the sessions with the couples to address relationship issues and also relationship issues, especially if they have problems in their marriage. So, couple counseling can help to improve communication, resolve conflicts, and strengthen their relationships, again, that had gone astray before the counseling. Group counseling. Group counseling involves sessions with the groups of individuals who are experiencing similar issues or problems. It can also provide a supportive environment and help individuals to feel less isolated in their struggles, especially if it is in terms of an institution or a school. Group counseling is important for them in that it can help them as they struggle to read so that they can be able to achieve what they want by the end of their studies. Let's look at the history of counseling. Counseling has a long history which dates back to the ancient Greece, where philosophers such as Socrates and Aristotle, they offered guidance and advice to their followers or their students. So the modern day counseling profession emerged in early 20th century and has continued to evolve. Let's look at the counseling process. The counseling process involves several stages. These include the initial assessment, goal setting, intervention, and evaluation. The counselor works collaboratively with the client to develop a plan that addresses the client's specific needs and concerns. Initial assessment. The initial assessment involves gathering information about the client's background, history, and current situation. So the information for the initial assessment is used to understand the client's needs and concerns. Goal setting. Goal setting involves identifying specific goals the client wishes to achieve through the counseling. These goals are used to guide the therapeutic process and also measure the progress. Let's look at the intervention. Intervention involves using various therapeutic techniques, and interventions help the client achieve their goals. These interventions may include talk therapy, cognitive behavior therapy, and other evidence-based approaches. Evaluation. Evaluation involves assessing the client's progress towards their goals and determining whether the counseling process has succeeded. The client, the counselor, and the client, they work together to evaluate the effectiveness of the intervention and make any necessary adjustments. Let's look at the counselor role and responsibilities. The counselor's role is to provide a safe and supportive environment where clients can explore their thoughts, feelings, and behaviors. The counselor guides the therapeutic process and helps the client achieve their goals. Let's look at the counselor's responsibilities. The counselor has several responsibilities, and these include maintaining confidentiality, obtaining informed consent, and ensuring that the therapeutic relationship is based on trust and respect. The counselor-client relationship. The counselor-client relationship, this is critical. It is really very critical in the counseling process, and most of the times it is based on trust, respect, and mutual understanding and it is vital for achieving positive outcomes. Building a rapport. Building a rapport is an important aspect of counselor-client relationship. The counselor must establish a connection with the client to develop trust and build a therapeutic alliance. Active listening. Active listening is a vital skill for counselors, and it involves listening attentively to the client's concerns and problems and responding in a way that demonstrates understanding and empathy. For example, you can respond by nodding your head. When you nod your head, the client will exactly know that you are understanding what he is going through. Empathy. Empathy is the ability to understand and share feelings of another person, and empathy is an important skill for counselors, and it helps to build rapport and also establish a therapeutic relationship. Non-judgmental attitude. A non-judgmental attitude is important for creating a safe and supportive environment for the client. The counselor must avoid imposing their personal beliefs or values on the client, and instead, they should maintain an open-minded and accepting attitude. In other words, when the client is presenting his or her problems, do not judge the client. Cultural competence. Cultural competence is the ability to understand and respect the cultural differences of the client, because all of us come from different backgrounds, cultural backgrounds, so it is important that we respect the client's culture. So it involves being aware of one's own biasness and prejudice and developing a culturally sensitive approach to counseling. Confidentiality. Confidentiality is a critical component of counselor-client relationship. The counselor must ensure that all information shared by the client is kept confidential, except in cases where there is legal or ethical obligation to disclosure of the information. That is, if at all the client has allowed the counselor to disclose the information, maybe to the family members or maybe to the friend, and also where it is legal and ethical for disclosure of the information. Informed consent. Informed consent is a process of obtaining clients' agreement to participate in the counseling process. Otherwise, if the client does not accept to participate in the counseling process, you cannot force the client. So informed consent involves providing the client with the information about the counseling process, including the risks and benefits, and also obtaining their consent to proceed. Otherwise, if the client does not allow, you cannot force the client to accept. Ethics in counseling. Ethics are principles that guide the conduct of counselors. The ethical principles include autonomy, beneficence, non-maleficence, and justice. Autonomy. Let's look at autonomy. And what does autonomy mean? Autonomy refers to the right of the client to make decisions about their treatment. So the counselor must respect the client's autonomy to involve them in the decision making process. Beneficence. And what does beneficence mean? Beneficence refers to the counselor's obligation to act in the best interests of the client. In other words, the counselor must strive to promote the client's well-being and to prevent harm. Non-maleficence. And what does non-maleficence mean? Non-maleficence refers to the client's obligation to avoid causing harm. Non-maleficence refers to the counselor's obligation to avoid causing harm to the client. In other words, the counselor must ensure that the interventions used in counseling do not cause harm to the client. Let's look at justice. And what does justice mean? Justice refers to the counselor's obligation to treat all clients fairly and equitably. In other words, the counselor must ensure that all the clients have the equal access to counseling services. Let's look at the limitations of counseling. Access to counseling services. Severe mental health conditions. In severe mental health conditions, counseling may not be effective in treating severe mental conditions such as schizophrenia or bipolar disorder. Another limitation to counseling is lack of motivation. Counseling may not be so effective if the client lacks the motivation or if the client is not committed to the therapeutic process. So you will not force the client. So because the client is not interested, he may not tell you or he may not disclose to the counselor all the problems that he is facing. Therefore, the counseling process will not be effective. So the client must be willing to participate actively in the counseling process for it to be effective. Another limitation of counseling is time constraints. Counseling may not be effective if the client has limited time for the counseling sessions. Remember, the counseling process requires time and commitment from both the client and the counselor. Let's move on and look at the benefits of counseling. Improved mental health. One of them is improved mental health. Counseling can help individuals to manage mental health conditions such as depression, anxiety, and post-traumatic stress disorder. It can also help prevent developing more serious mental health problems, in that when the client talk about their problems that are disturbing them, and also with the help from the counselor, the clients are able to overcome these problems that they are facing. Then they get relieved from the problems they were suffering from. The second benefit is improved self-esteem. Counseling can also help individuals to develop a more positive self-image and improve their self-esteem. When an individual is counseled, the client who thought that maybe he was of no value at all, as time goes on in the counseling process, he will realize that really he is also a useful person, and this will help to boost his self-esteem. The third benefit of counseling is better coping skills. Counseling can help individuals to develop better coping skills to deal with the stress which they could be going through, anxiety, and also other challenges. Then the other benefit is improved relationships. Counseling can help individuals improve their relationships by developing better communication skills and learning to manage their conflicts. And increased self-awareness. Counseling can also help individuals to become more self-aware and gain insight into their thoughts, feelings, and behaviors. Thank you for listening and have a nice evening.